Hey friends, how you all been doing? I am Dr. Ann, an anesthetist, and welcome to another dose of happiness and health. Today we are going to look at what happens in the anesthetist office when you go for your pre-anesthetic checkup. So let's dive into the video. As you already know, when you step into the anesthetist office, first you will be asked your name, your age, what is your diagnosis, and what surgery has been planned on you. But your surgeon would have written all of those and given you in a piece of paper and sent you to the anesthetist. Depending on what surgery is going to be performed on you, your anesthetist will decide if what anesthesia has to be given to you, like if you will be given a spinal or an epidural or a nerve block or any other block. Your anesthetist will then decide, and depending on what anesthesia you're given, your anesthetist will ask a few questions that are related to other medical conditions or medicines you might be taking, so that your health will be optimized for surgery, so that the anesthetic drugs won't cause any harm for you. At first, your anesthetist will be asking you about your past history, if you are a diabetic, if you are a hypertensive, if you had coronary artery disease or thyroid, because all of these you might be taking medicines for them, and depending on each condition, the medicine has to be stopped or you have to take it on the day of surgery, on the day before surgery. So when your anesthetist asks you about oral medications, you tell them about what all medicines you are taking, so that they can give you information on how to take the medicines on the day before surgery, or if your blood sugars are not controlled, or if your hypertension is not controlled, your anesthetist will send you back to your physician, so they will alter your dose, and so that your anesthesia will not produce any harm on your body. And talking about the medicines you are already taking, even if you are taking contraceptive pills, I recommend that you tell everything to your anesthetist, because certain medicines that we use for anesthesia, they might interact with the contraceptive pills, and your contraceptive pills might not work. So if you tell everything about, or if you talk about that with your anesthetist, then they will advise you to use some other type of contraception, or if there is no interaction between the medicines, then that's also fine. So, and your anesthetist will ask you also about previous surgeries, if you had any previous surgeries, and if you had previous surgeries, your previous experience with anesthesia also. This will also be asking about your previous experience with anesthesia. If you had any complications, if you have general anesthesia, your anesthetist will ask you if you had any trouble being intubated, or if you were aware under anesthesia, if you had any complication like postoperative nausea, vomiting, or if your spinal, was it easy to get your spinal on, or if it was hard. All these questions your anesthetist will be asking you, and then your anesthetist will also be asking you about your personal habits, if you're smoking, if you take alcohol or any other drugs, because if you have been taking drugs or alcohol, the dose of anesthetic that will be given to you will have to be increased, because it might not be effective on you as compared to a person who has never had alcohol or drugs in their life. So your dose will have to be optimized depending on that. So I highly urge you that you do not cover up any of these habits that you might have. Your anesthetist is not going to judge you. We just want to know how frequently you drink, how much you drink, because we have to optimize the dose, otherwise the dose will not be sufficient to relieve you of the pain of surgery. So bear that in mind and be open. And then your anesthetist will also be asking about your family, if they have had any bad experiences with anesthesia, like pseudocholinesterase deficiency or malignant hypothermia or any of those complications. And also coming to the previous history of anesthesia, they'll also be asking about if you had halothane in the past 3 months, because it's hepatotoxic and you can't take that again within 3 months. And then your anesthetist will be examining it, the usual routine. They'll be checking your heart rate, your respiratory rate, your temperature, your saturation, and your blood pressure. And then they'll be checking all the individuals, like if your cardiovascular system is fine, if your respiratory system is fine, if your abdomen is fine, if your central nervous system is fine, just to make sure that nothing is wrong with you and that you are good to go for anesthesia. Because if your anesthetist finds something wrong, they might send you back again to the physician to optimize you, so that anesthesia won't be harmful for you. So just bear that in mind and you'll breeze through the pre-anesthetic checkup. There's nothing to be worried about. And after that, depending upon the type of anesthesia, anesthetist will also be checking like how far, checking your mouth opening to see how wide you can open your mouth, because like if you're going to go under general anesthesia, you will have to be on a ventilator, because the medicines we use for general anesthesia, they paralyze all the muscles including the respiratory muscles, and you won't be able to breathe. So you will be on a ventilator. So when you have to be on a ventilator, you will have to be intubated. By that I mean you will be put a tube through your trachea, through your mouth, throat, and into your trachea, so that a ventilator will be breathing for you instead throughout the course of anesthesia. For that, to put the endotracheal tube into your trachea, your mouth should be, you should be able to open your mouth sufficiently so that it will be easier to get the tube in. Like if this is all that you can open your mouth, it's going to be hard putting a tube in and finding the right hole so that it doesn't go through the food pipe and goes directly into the windpipe. So your anesthetist will be checking all those to make sure that your mouth opening is good. Like this is a rule in anesthesia that if you are a healthy person, for a healthy person, the mouth opening should be 3-finger width. You should be able to put 3 fingers into your mouth. That is a normal person. So in those cases, we won't be worried. And when you look into the mouth, certain structures should be visible. That is the Mallampati score. So we'll be scoring your mouth opening and the structures we visualize inside your oral cavity to just to like predict how easy or how hard intubation will be for you, so that we can also be prepared. Like when you know that someone is coming for whom the mouth opening is not very good, then your anesthetist will be prepared with other equipment which might be needed to breeze through intubation. So that is why your anesthetist is asking all those questions. And your anesthetist will also be asking a few questions about your teeth to check if you have any dentures or loose tooth, or if you have even a crown from root canal therapy, because like I said, when you're intubating, when an anesthetist is intubating you, we don't want your denture to go into your windpipe and choke you, right? So that's something that your anesthetist will be asking to check. So even if you had a root canal surgery, sometimes you might feel that all this information, why are these anesthetists asking me all these questions? I mean, they are so irrelevant. Why are they doing all these stuff? So, but when you look at what they're doing actually behind the scenes, why are they checking for the things that they're checking? Why are they asking if you have had a root canal or you have loose tooth or something? Just be patient. Very patient with your anesthetist. I know you're jittery and you want to get this all done and the surgery done and go back home. So, and then your anesthetist will also be reviewing all your investigations, like your complete blood count, your hemoglobin, your renal function tests, your liver function tests if you needed them, or your thyroid function tests, and your electrolytes. You had your ECG done, your X-ray, your echo if you had any comorbidities, and your serology, and just to make sure that everything is optimized. And if everything is fine, we can go ahead with anesthesia. And then finally, after everything is done, your anesthetist will be giving you a score given by the American Society of Anesthesiologists. They'll be giving you a score like ASA 1, ASA 2, ASA 3, ASA 4. As you can see on the screen, the anesthetist will be grading how much risk anesthesia carries for you. So if you have ASA 1, most probably you won't have any difficulty during anesthesia. Most probably, that's what your anesthetist is saying, but we can't tell like how your surgery is going to go, all the complications that might arise. We are not telling about that. We just predict that it's going to be smooth, anesthesia is going to be smooth. And if ASA 2, 3, 4, as you go along, the numbers, it might be a bit hard for you, and that's why your anesthetist is scoring you. Like when you're going into anesthesia, your anesthetist won't be able to talk and talk all these stuff again to you on the day of surgery. So they will be recording all this to get an idea of how anesthesia is going to be for you, and they can also be prepared with all the equipment and personnel to help them out during anesthesia. And your anesthetist will also be giving you information on how much you have to fast, how long you will have to fast, like when should your last meal be before your surgery, and they will also advise you about all the other medicines you will have to take before anesthesia to keep you calm, or if you're a diabetic or a hypertensive, your anesthetist will be giving you appropriate advice about what to do, when to stop the medication, when to not stop the medication, and all of those. So that's all that your anesthetist will be doing for you when you come for the pre-anesthetic checkup, and there's nothing to worry about. If you have any questions, to ask your anesthetist. If there are any fears, or if you want to know about what the procedure for anesthesia is, you can ask your anesthetist when you come for the pre-anesthetic checkup. And all of us, we're here to help you. And I mean, going under anesthesia is quite a big thing, and we realize that, and we will be there with you, and there's nothing to be worried about in case of anything. And it's always nice to get to know your anesthetist, and for us to know you before you have your surgery. So it's really nice having the pre-anesthetic checkup. So feel free to talk to your anesthetist, build a rapport with your anesthetist, so that you can also be calm, knowing that you're in safe hands and there's nothing to worry about. So that's it about the pre-anesthetic checkup, and thank you so much for joining me. Hope it was useful for you, and I alleviated a few fears about anesthesia. See you again in the next video next week. Bye.